How about building collapse due to snow on the roof of buildings?
Yeah.
Can somebody be pinned underneath that? How about construction sites where equipment has fallen and crushed somebody?
Yeah.
Those are the types of things that we're gonna respond on these kinds of things where people are stuck and need to be freed, okay? So when we get there, what did you guys do with the person that had their head stuck? What's the first thing you guys wanted to do?
Airway.
We wanted to pull them out. Everybody's thinking like, oh, let's just get them out, right? So now your thought process is going to change a little bit. We are going to slow down on, hey, we're not just going to pull you out until we know exactly what's going on. Granted, this was not a very good scenario to use crush injury.
Okay, that's what I was
Yeah.
gonna ask.
Yeah.
All right.
So let's say, hey, Cody stuck his arm in the machine, and he's been there for an hour, and he's talking to you, and you're like, oh, hey, can you pull that out? It's like, oh, if he's been there for an hour, we're probably going to be like, no, we're not going to pull that out.
Yeah.
Because there's things that we're going to want to do before that, okay? So most of the time, this is lower extremities that occurs, that they are trapped. And why is that? Because most of the time, if your hand is stuck somewhere, you can wiggle it out and get it pulled out, right? You have more ability, more flexibility in your arms, and your legs can only go certain directions, right? So if something falls down on your legs, you don't have the ability to articulate as well as you do with your lower extremities, okay? And a lot of times if you just pull, are these bones easier to break and get it free? Versus a giant femur that's crushed and pinned. Can you break your own femur trying to get yourself out? Probably not. I mean, maybe some of you that are super strong like Cody, maybe. Okay? And then you only got a small portion of it is your trunk, and that's just basically a full body stuck, right? Are those going to be fun ones to get out? No. Are they going to be a long process to get out? Okay. So the crush syndrome started back in World War II, when the buildings would be, they would have bombings, building collapses. They'd pull people out of these collapses, and then think that they're all okay, and then what would happen?
Then after a while,
After a couple days, they would end up dying. It's like, oh, hey, what's going on with this? They started doing some investigation, started running blood labs, checking on it, and realizing it's like, oh, their chemical makeup in their body is completely out of whack. Okay? All right. So we talked about rhabdo a little bit yesterday, or was that today we talked about that?
We didn't talk about rhabdo.
I remember you saying it, I just don't remember.
I'm trying to remember what the context was.
I don't remember.
We talked about
Mentioned
in
it working out.
I think it was at workout.
Suffering and pain.
That wasn't even working out, that was just rolling them out.
That was just rolling, and I got rhabdo in my hip because we were rolling. Got it. Right? So when you get muscle breakdown, which was happening, you guys were breaking down my muscles while I was doing that, right? Destroying my muscles, which was basically creating a dump, not in that situation, but in a crush injury situation. So your muscles start to break down and create this chemical imbalance, right? I think this is the one that says, here we go. All right. So you have your initial injury. Boom, it's trapped, it's pinned. Okay? So initially you have damage to, let's say, Dustin's arm. It initially happens. You're stuck, okay? You're going to be stuck for a little while. So good luck with it there, okay? So his arm's stuck, right? So you have the initial damage that happens, but he's still stuck. So what's going to continue to happen?
It's going to continue to deteriorate.
Right, so is it getting oxygen? No.
Yeah.
So what's going to start to occur? So if these
Lactic
muscles...
acid are going to build up.
There we go. So lactic acid is going to start to build up because it no longer has the oxygen. So it's still trying to work. It's still trying to exchange nutrients. But what is it using? It's using its what type of metabolism? Anaerobic, right? Yes.
Yes.
I was just going to ask the difference between this and just a simple tourniquet is the fact that there's no damage to the muscles.
Right. Yeah, that's exactly what it is. So you don't have the damage to those tissues, and a lot of times the tourniquet goes on, and the tourniquet will just come off.
Okay.
Basically, you're just decreasing
6
that.
hours.
Are you still going to end up with the potential? So when you release a tourniquet, what do you still have the chance of happening?
Lactic acid buildup.
So do we take tourniquets off in the field?
No.
Why is that? We don't want
Because-
that massive influx, right? So it's similar, but there's a lot more damage associated with it now. Because we're going to cover, tourniquets are very important for you right now. They're going to be very important for you, okay? So you get your lactic acid buildup, okay? I think we got that. And then those cells start to break down, cell wall permeability, and starts dumping out into the interstitial space. So then what occurs around it? What starts to occur?
Swelling.
Edema and swelling, right? So now Dustin is pinned by something, right? So he's pinned right here, and now all these tissues, this stuff here, is going to start to do what down here?
Swell down there.
Swell. And if he's pinned here, what happens directly underneath where he's stuck? If this swells, it's going to get tighter and tighter and tighter, which is going to do what?
Cause more.
More and more damage, okay? So, recognizing, oh boy, this is not good. You show up, Dustin's pinned, he's been there for an hour, and his arm looks like a balloon, and I kid you not, that's what they look like. It looks like you just like, and pump the hand up. Like, there's no joint ability, there's no joint movement, there's nothing like that, okay? So he has no ability to basically, we'll be like, hey, can you wiggle your fingers? And this is the extent of what happens with the fingers, okay? If he can move them at all, right? And so you get that fluid buildup, which then is just going to increase the damage that occurs. And then yes?
That's only if you're able to see the other side, right?
Correct.
So if you're in like a trench collapse scenario and there's pressure on your body from like
You're not
sediment,
going to see it at all. You're not going to see the swelling at all.
or are they gonna have that same issue because there is no room for swelling?
So what's going to happen? So if you are completely pinned off, so say you have this area here so from here down is stuck, right? And it don't have the ability to expand, where's that swelling going to go? Where it can, right? So it's going to start forcing that fluid up into the upper torso. So you're going to pull them, when you finally do pull them out, what are their legs going to look like?
Right.
Be super scrawny and like compressed and smashed, and they're going to be so sick by the time you get them out. They're going to look really, really bad, okay? Because do you guys remember how much like dirt weighs?
Wow.
I think it's even more than that. Yeah, it's a crazy amount, right? So like trench rescues are the real deal. Like it is a crazy amount. Like you watch people, yeah, and that doesn't include like concrete, cement, rock, any of that. That's just straight dirt. So okay, so as they continue to leak, more cells die, right? And then they start to dump all those contents that are in the cells. And this is where stuff starts to go south for you guys. So you're just going to start dropping your myoglobin, your potassium. Is potassium a big deal to us? So if there's a lot of potassium in the interstitial space, what does that mean?
It's
There's
necrotic.
there's none in the cells.
There's none in the cells. And so what is happening in the body now with that potassium? What kind of effects does potassium have in the body?
Yeah, potassium's going to continue to draw more potassium out of the cells. Potassium's necrotic, so it's just going to continue to kill things around it.
Right? And so what major muscle in the body
The heart.
likes potassium, right? Needs potassium.
To reset.
So what do you think the chances are that this person starts throwing dysrhythmias?
Hi.
Are you guys ready to run a code with somebody that's pinned?
Yes.
No, because what are you guys thinking? We're like, oh, let's check a CBG and check your pupils, and right? Because we're in a trauma scenario, right? We're in this altered LOC trauma scenario. We'll be like, this guy's got his arm stuck. Oh, weird. Now we're throwing curveballs at you guys, and here comes even more scenarios. So now you're going to think mega code, trauma scenario, crush injury, and altered LOC all at the same time. And you got to do it all within about
H's and
10
T's.
seconds of seeing the patient. Yes. Just. Huh?
Wouldn't that be a trauma code?
If you call a trauma code on that, I will disown you as a student. Okay? Because there are things that you can fix. Remember, consider the causes. Right? He's still altered, he's still awake, and he's still talking.
And the blood's still in my
And
body.
he's still in his body, right? So I am gonna delete trauma code out of the pre-hospital setting thought process forever.
We call it hypovolemia code.
Okay? So you got all kinds of toxic substances now floating around in the body because of all this cell damage and tissue. This is the best slide of the whole thing. Take good notes on this one. Yes.
How big of a surface area of the body needs to be crushed in order to have those sorts of effects when it's
One more time.
released? So how big of a surface area of the body needs to be crushed in order to have that release of?
So if I smashed his arm here and he was
Yeah.
pinned for an hour, and then if I didn't do my job and I didn't do things right and I went like this and just let all that go, pretty sure he's gonna go into some sort of dysrhythmia, maybe even VFib potentially.
So what about like just a hand from the wrist? Is that even enough?
Finger trapped or
Or
is
A
it-
finger, I think you can get away with a finger, right? So I would say anything with major vessels, so like the hand, you probably get away with having a smashed hand. But anything that as you start to move up on the forearm at all, that's where you're gonna get, and a lot of it is just simply gonna depend on if you go like this.
Okay.
Oh, hey, and we're free. Hey, awesome, right? So you guys are gonna learn a little later, you guys may need to coordinate with people on when things are going to occur as you release people, in order just so that you don't get this all of a sudden. Because I'm gonna love it, if you guys do that later. It'll be fun. It'll be fun all the way around for you guys. Okay? And go, and down, okay? So this person was pulled out of a earthquake, had a crush injury around the pelvis. So I'll be right, you guys can't even see that, can you? You can tell that it looks bad though, right?
What is that?
A butt
It's their fingers.
Back
It looks like
in the
a-
rear end.
It looks like a kielbasa.
pelvis
It's their two
with
fingers,
cellular
right?
carcinoma.
What is that? I think it's the rear end.
You think that's a rear
It's a
end?
pelvis.
So we have a pelvic injury.
That is definitely a pelvis.
The person facing.
Are they sitting on the zero?
Somebody's sitting on the x-ray machine on the camera, getting pictures.
Well, all that red might be the butthole.
So you can see, so I don't know what part exactly this is, but you can see the type. So what do we notice with the skin around this area? Do we
It's
notice
swollen.
anything specific?
Distal, it's swollen.
Okay?
There's a big
So,
hole.
so, do we notice anything this leg compared to that leg?
Yes.
Yeah,
This one may or may not, we can't see the whole leg, right? But it may look like there's a little bit more. You notice that there's a little more damage over on this side
Yeah.
compared to this over here maybe? But the thing that I'm really picking up on right here is this right here,
The line.
okay? You have distinct lines of where damage, potential trapment occurred, okay? So those are the kinds of things that you're gonna need to be picking up on as you maybe release somebody from their trapped spot, okay? Do you think this person was there for a long time?
Yeah.
Yeah. This is a long-term thing. You guys will probably, I would hope, never have anything long-term like that. It's gonna be, yeah. It's gonna be something where there's an arm stack, a leg stack, something like that. Tractor rollover. And the tractor rollover's been the one that we've most commonly gone to here locally. Okay?
For how long?
I want to say it was 2.5 hours. Basically, they rolled it over, person got pinned underneath it and was stuck. All right, so let's see. So with these patients, 50% that were pulled out of an earthquake after being pinned or entrapped, had 50% of them had renal failure. How do we fix renal failure? They were totally fine before the earthquake, now they got renal failure. Do we have anything to fix that?
Sodium bicarb?
Oh, we do have some stuff, don't we? Bless you, bless you. So 50% of those that ended up in renal failure ended up needing dialysis. So 25% of all people that were trapped ended up needing dialysis. All right? And 50% of casualties required, I'm not even gonna try and pronounce that. You guys know what that is?
Yeah.
Yep, so your leg gets so swollen, your leg, arm, whatever it is, gets so swollen, basically take a slice on each side, open it up, allows the tissue to breathe a little bit. Okay? So you have your local tissue injury, like what we had with those distinct lines, and then you have your organ issue, where things start getting that influx of imbalance, right? Your potassium influx and stuff like that, right? Which then leads to your metabolic stuff. Oh, man, look at this one. How do we fix crush injuries? Oh, man, you have so many things to choose from, so many things to look at. So what is the first thing that we're going to do?
Sodium bicarb.
IV fluids.
Fluid, okay? We're going to get lots of fluids, okay? Because what's happening?
They're kind of losing their fluid as it's getting trapped down in the.
Yeah, so is fluid in the interstitial space fluid that is located in the circulatory system. No. So they are going to become hypovolemic very, very quickly. If it's the larger the portion of the body that's trapped, the quicker they are going to go into hypovolemia. Okay, so we're going to get lots and lots of fluid. Then we start running down our renal failure stuff and our cardiac dysrhythmias. We can do stuff about both of those, right? So we got our hyperkalemia protocol that we can follow, and then our cardiac arrhythmias. Are we still going hyperkalemia in those? So boom, we're still back to the same meds, right? So it's pretty simple on the meds that we're going to potentially give. And then secondary complications, there's not a whole lot we can do for compartment syndrome. Compartment syndrome is basically just that increased swelling around a generalized area. That's going to be a long-term effect. Thanks.
Wait, can you go back to one
Oh,
second?
yep, go back.
Why couldn't you provide dopamine in higher concentrations instead of your fluid? Because
Okay, so cool, yeah, love it. So I like the idea. So dopamine, so how do we fix hypotension?
With fluid first.
But you could do peripheral vascular constriction with dopamine, and you could increase the heart contraction. Which
Right.
the problem with hyperkalemia is that eventually they're gonna not.
Right, so you're gonna eventually end up having a massive shutdown of the heart muscle, right?
So why don't you just do that?
Go with the dopamine. So think about the fluid. So we fix the fluid problem first, right? So we're dumping all of our fluid out into the system. You put dopamine and you can get dopamine going. That's a cool idea. But if you don't have the fluid in the system for the heart to pump and create, because depending on the size of the amount of your injury, you're just dumping all your fluid in the interstitial space. You're turning it into the Stay Puft Marshmallow Man with the just giant swelling. Okay, so edema, not in the circulatory system. So if you don't have the fluid to be able to circulate, then you're going to lose that ability to vasoconstrict down onto any sort of fluid. So that's why it's a quicker and easier fix to get the fluid. And I'm not saying at all that dopamine is not in my thought process as we start to get this person out, but it's not one of the first quick, easy fixes to get this done. You're going to have a lot of other things going on prior to that release.
Will that fluid also help to dilute the toxins that you're...
Yes. Yep. Okay. So you got all kinds of hyperkalemia, hypocalcemia, and you got your acidosis. So what medications can we give?
Calcium chloride.
Calcium glucose.
And sodium
You guys got all kinds of cool ideas, right?
Lactated ringers, but we don't have them.
Oh, you want to give lactated
Why
ringers?
would you want?
You want to give lactated ringers? Dustin, you want to repeat? You want to give lactated
No,
ringers?
I'm reading.
Wait, no.
Be avoided.
Should be
Is that
avoided.
on video?
No,
You got Dustin saying lactated
Yeah.
ringers?
Yeah.
But I didn't finish my statement. I didn't
Read
finish my
lactated
statement.
ringers and you got
Lactated
excited.
ringers should be
You're like-
avoided is what I was gonna
You were
say.
gonna say it's gonna be avoided,
Yeah.
right?
Lactated ringers should be avoided.
All right,
Yeah.
so we want normal saline, and why don't you explain to everybody why we want to avoid it then?
Because it's full of nutrients that you are already high of. It has potassium, it has all these other things in it that would make it go up higher.
All right, so we don't want any excess
No.
potassium
Nope.
in the system,
Nope.
right?
Calcium.
We want to, yeah, the potassium and the calcium. We want to limit as much of that as we can.
Right.
Has a good taste
Right.
of potassium and calcium. Yep.
So if we're putting more into the system, hey, guess what? We're going to fast forward you into VFib. No big deal. Just sit back, enjoy the ride, right?
Mhm.
So it's interesting because it was like, I thought it was pretty interesting. I was like, let's see if I can catch anybody. Like, hey, what do we do? Because I was actually going to ask the question before we even got to it. I'm like, hey, let's say we got lactated ringers. Yeah, you guys want to do that? Because is lactated ringers the best that everybody knows lactated ringers is way better than normal saline, right?
In certain
Right.
circumstances.
Except for this,
Yeah.
right? So it's kind of one of those trick things. I like to set you up. So you did a good job of just setting yourself up.
Thanks.
So,
If
okay.
you could have whole blood, would that be the best? Or are you wasting whole blood by just dumping in their?
You're not, it's not blood in the interstitial space.
Yeah, it's not the blood. You still have the blood. You're just losing
The plasma.
Yeah, you're losing the fluid, the interstitial damage from that. So the blood's actually not going anywhere. So you got all the same red blood cells. You're not losing any of
Just
that.
concentrated.
So I would have to, yeah, I would have to research that a little bit because it's not in any of the like confined space, TRT. information in regards to whole blood. Nobody has recommended it, so I don't know, I'll have to look into that. Okay, so treatments, here we go. We got somebody that is trapped, their arms pinned, doesn't still pin. So we got multiple different things. So you got calcium chloride you can give, you got bicarb you can give. Huh, you got albuterol you can give. That's weird. Oh, so you give the albuterol, and what does that do to the potassium?
It helps push it back into the cells.
Forces it back out of the interstitial space, back into the cells, right? Is that a super easy one to get started for somebody that's stuck?
Yeah.
Right, you don't have to do an IV, you don't have to do anything.
back again? Jumped on
Whoop, whoop.
Right there,
One
back
more.
in here.
One more.
Too far.
I must have
There you
bumped it,
go,
I'm sorry,
yeah.
I didn't mean to bump it. And so, yeah, so it's a very easy, very quick one to get started on it.
Can you go over why butyl?
Yeah, because what it does is so albuterol promotes the ability to take the potassium out of the interstitial space and push it back into the cells. It facilitates that. I don't know how. I don't know why.
Okay, it just does.
That's a
The
Corey
mechanism of
question.
it.
And so then it
That's a
changes,
Corey
like, the
question.
cell
That's a
wall.
Corey question. Good.
So it
Yeah,
changes
that's
the
one of those
cell
stupid
wall.
mechanism things that they say we do it, so, and they tell me why it does it, or they say the reason for it. I'm like, oh, that makes sense to me, okay, boom.
It must change like cell wall permeability also because that like increases his question.
Yes.
How long does it take effect?
Albuterol?
Yeah.
Like, that's why I said it's a quick and easy one to get things started. It's like a
Well,
very
no,
quick.
like getting it ready, yeah, totally fine, but
And
like
it
in the
was-
body way.
Right, no, it's, as soon as it's in the body, as soon as it's in the system, it starts to take effect, right? So it's a small amount that it starts to help facilitate. It is not one of our, like, go-to fixes. It's not gonna fix the whole problem. Like, it's a very minor fix, but it's a thing that is aiding us as we start to do our bicarb and our
So
calcium.
it's almost something that as soon as you realize what you're gonna have, you just put them on an NRV with a
Yep.
nebulizer.
Exactly.
Give them albuterol while everybody else is setting up, turning gets an IV.
Exactly.
And it was 2.5, it was the same dose.
It's the same dose.
Same dose.
But you don't use ibuprofen with this.
No,
You're not
so
gonna-
this is, you cannot use your Duonep. So all that Duonep packaging,
Yeah.
you don't wanna give them Atrovent, because what's Atrovent do?
It's gonna,
It's a long lasting.
well, it's gonna block the parasympathetic system, so you're gonna raise the heart rate, but albuterol is gonna raise the heart rate. It's gonna dry up secretions, but
Athematic.
I'm just trying to think why it's gonna be bad.
Does it have any alpha effects?
Atropine? Atrovent, sorry.
Anticholinergic.
I mean, both are the same, but.
Alright, we'll come back to that.
Anticholinergic, so it would be
Alright.
all.
So, blah, 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 here's a lot of this stuff. Corey question, boom, right there. The tubular precipitation of the myoglobin, I don't know. Straight up. I don't know, okay? Fluid.
Wait, go back. Decrease your, thanks.
So are we, when we're pushing fluids in, yes, all the fluids have been pushed out of their cells and are in the interstitial space. But when we're pushing fluids, are we doing like we normally do in trauma, pushing fluids to maintain the blood pressure? Or are we just
Nope,
hammer them with
you're
two
hammering,
wide,
you're hammering them
full
with
bore,
two
16
2-liter bags. So you're going with the full 2 liters.
You,
And is that because it's a closed system and they're not gonna lose it?
Correct.
are you monitoring lung sounds
Yes.
as well?
Yeah, because obviously you can't drown somebody. You're not gonna wanna drown somebody. And so if we're back to our torso person, and now we start ending up with fluid in the interstitial space, only in the upper torso, eventually where's that fluid gonna end up going?
In the lungs.
Into the lungs, right? So now you're really having to pay closer attention to the amount of fluid that you're giving and your fluid resuscitation with those lung sounds and stuff like that.
And does the fluid correct the acid?
No, it just simply dilutes,
Okay.
right? So what do we have?
It just, the slide says correct your acid.
Yeah. What do we have that we're fixing?
Sodium bicarb.
The bicarb is what we're using to fix it, okay? You guys know all the signs. You guys can catch this stuff. You guys can recognize it way before it happens, right?
No.
Flatten T-waves every time.
Yeah.
Right?
Yeah. The peak T waves.
Big T-waves.
Right? So
Oh, but that's
like,
mild.
Those are like things that like it's telling you before it's happening. Hey, hello, I'm starting to get there. Hello. Like pay attention to me,
So,
right? So you guys have all gone over this stuff, right?
The prolonged PR, is that just gonna look like our first degree?
Mm-hmm. You can create that first degree, your QRS is gonna start to get wider and wider, eventually you're gonna turn into like a junctional looking, and then it's gonna turn really wide, it's gonna start to become like almost idioventricular, but it's gonna be like the accelerated idioventricular, because you're still at the same rate, but now you're end up with a Y complex. If you end up, when you get there, the person's already in a Y complex rhythm, you'll be like, ah, son of a, right? Because you already know you're way, way behind.
Atrial standstill?
Mm-hmm.
But you still have the rate of
What's the
a
atrial
SNO?
I mean, because you're still getting electrolytes.
Nature is not working.
So would it almost look like AFib? Because you.
Except it's not irregular, so it basically, your atria basically stops firing.
So you're gonna have electrical activity, but you're not gonna have cardiac output from the atria.
Yeah. So basically, it basically just kind of stops, and the ventricles are continuing to pump, right? So as that atria, you get that massive influx of the potassium, right? So eventually, this is going to turn into like a VTAC, or eventually into VFib. So you're going to start getting tackier and tackier ventricular rate to that point where it goes into a pulseless VTAC or into VFib. Ventricular rhythm, yeah. All right, you come across this person. You cannot see how trapped. This is from here down.
Look at those eyes.
From where to where?
From here down. You can see what you can see is the only thing that's not trapped.
So pretty much
What's
shoulders
on
and
him?
left arm.
It was a giant building that had collapsed in an earthquake. This is down on the U of O campus. It happened yesterday. You guys respond on it
Today?
right now.
Wait,
So more than 24 hours.
Yeah, you guys are like mutual aid people coming in to help. Like, I mean, it's a big deal. We got multiple buildings that collapsed. I've now got you guys there. What's that?
You know they're screwed up again.
Yeah. That's the thing. It's like you're not gonna get there much there.
Estimated time of how long we can take,
It must
we
be.
can get him out?
Yeah, it's gonna be a while.
That's not
I don't know. Like, there's no guarantees. Like I work the truck, right? I do this kind of stuff. I'm gonna look at that person and be like, hey, it could be 10 minutes. It could be 2 hours, right? You just don't know until you start moving things and start doing stuff. Like, I can throw out as many rough estimates as possible, but I'd just be lying to you the whole time. I'd just be making up something so that B would be happy. Be like, hey, here's, yeah,
How
we'll have him out in 2
long
minutes. 2.5 hours later, we're still digging, trying to get him out.
How's his
Airway and breathing.
Airway breathing, he is, would you guess his airways okay, just based on the way he looks?
It's mentation, yeah.
Would you call him sick or not sick?
Not yet. Not yet.
Well, from making
he's been there for a day though?
Right, but like what we said
But
earlier,
he's
it's like,
not currently.
we're not totally there, but we're pretty sure this
We're
person's gonna
gonna
get
be,
super sick,
yeah.
right?
They're gonna be.
We're gonna be.
Gonna be, right? So then as you start to peel this person back, you start to see, and they get to that point where it's just like, okay, the more I see, okay, it's mid-thigh. This kid is stuck mid-thigh bilateral. Okay, so right here he's pinned, everything else is out. Okay, you can't see anything else. He's trying, it's something big. The truck company's doing a great job. Really boom on it, they're getting this kid out.
Yeah.
Remove the one bolt and it
One
goes.
bolt, go down the Oh, hey.
We have a question for you.
Oh, yeah. Well, what was that question?
I'll be wrong.
How does
albuterol work?
Oh.
That's what I said. I was just like, it runs the potassium back in, shoots it back into the cells. I couldn't tell you why though. He doesn't know. Good.
For some reason, I feel like Corey's gonna say, why doesn't it?
Just so you know, we only have 25 minutes. We've got like 50 slides to get to, so.
Let's continue on and we'll come back to it if we have time.
Okay. Oh, okay. We'll come back to it. Hey guys. He's gonna go look it up.
Does he have any other
It was
bleeding?
one of those ones I said, that's a Corey question. I feel like
Okay.
I feel like he just quit. All right.
Tourniquet.
Yeah,